Hello guys, let's talk about one of the most commonest mental health illness that people confuse for professionalists. Yes, professionalist is different from OCD. Professionalist, as we all know, is someone who requires flawless results and performance. Why OCD is obsession and compulsive disorder. They are two different things. But in this video, I am going to explain in detail what OCD really is. Yes, I have said it before. It is not just the people on the streets that are not wearing clothes going around that are mad. Yes, there are many types, there are like 200 types of mental health illnesses, and so many people have these illnesses and they go about their normal business without you even knowing, because they are able to dictate it and they are taking their medications. Yes. Now, what is even this mental health? Mental health is the psychological, emotional, physical well-being of people, which affect the way they think, the way they act, and even the way they relate to people. And it goes further to affect the way they take their decision and even the way they relate or handle stress. So you can see this is a very, very, very important topic, and you must listen to learn something from it. Now, what is OCD? This OCD obsession is a repeated, persistent, and unwanted thoughts, urges, or images that are intrusive, which may cause distress and anxieties. Yes, you may want to ignore them or get rid of them by performing impulsive behavior or rituals. These OCDs typically intrudes when you are trying to think about something else. For example, maybe you are thinking about traveling and you are an OCD patient. What next comes in your mind is, what if that plane crashes? So, on the other hand, this OCD compulsive behavior are repetitive behavior that you are driven to perform. Yes, this repetitive behavior or mental act is meant to reduce your obsession anxieties or stop something bad from happening to you. But unfortunately, this compulsive behavior usually give just temporary solution to these anxieties, and most of the time some of the compulsive behavior that one exhibits during this obsession, it's not even supposed to help you calm down or solve your OCD problems. So, this obsessive compulsive disorders features a pattern of unwanted thoughts and fear. That is obsession. Unwanted thoughts and fear, which leads the person to repetitive performance, which is compulsion. Yes, when someone is scared of something and then take a repetitive act in order to suppress that fear or thought, that is obsession compulsive disorder. And this affects people's daily life and can lead to serious distress. That is the simple definition and explanation to this obsessive compulsive disorder. And now that brings me to, what are the symptoms of these OCDs? So in this symptom, I'll be giving you the symptoms and examples separately, because sometimes people exhibit their symptoms differently. Some people might have just the symptom of obsession, while other people might have just the symptom of compulsion, while some people will have both symptoms. So let's start with the symptoms and example of obsessions. One of the symptoms is fear of being contaminated by touching things or shaking someone. Example of this is if you see someone that is always scared of touching rails, staircase rails, or maybe pressing elevator buttons, or when you want to shake the person will be scared that it might contact germs or something. Check this person well. This person might be having OCD. Yes, because this is the commonness of them. Number 2 is doubt and the fear of tolerating uncertainties. Doubt and fear of tolerating uncertainties. Example, the fear of, do I know if I locked the door? Are you sure if I turned off the gas after cooking? You know. Number 3 of this obsession symptom is wanting to have everything orderly. As in, they want to have everything orderly. Like, you see this comb now. If you keep it here face down, he wants it face down. Once you face it up and she comes and sees it, it might give that person panic attack. So the person might start having anxiety attack just because this thing is not facing down like this. Yes, that is one of another symptom. Then symptom number 4 is aggressive or horrific thoughts about losing control or harming his or herself or other people. Example of this one. If you see someone that sometimes they say we have phobia for driving. It might not be, phobia is another type of mental health illness. I discussed it in one of my videos. Phobia is another type. It is different from this OCD. So when someone is having this horrific thoughts and this fear of having, most people that are down with OCD cannot drive because they are always scared that maybe now if I drive this car now and get to where there are crowd, I might lose control and either injure myself or injure other people. Number 5 example is as in kind of they are always scared of falling hands in the public. Like they are not even sure of the character that they are going to exhibit. That is unwanted thoughts, including aggression or sexual or religion subjects. They are scared. They don't want to act inappropriate. So you see them withdrawing from all these activities because they don't want to act inappropriate. So these are the cardinal 5 symptoms of obsession. Now, what are the symptoms of compulsion? One of the symptoms is washing and cleaning. Men, you might see this person will continue washing their hand though because they touched someone. Because she has touched someone or maybe she has touched a rail. She will wash this hand though until the hand becomes raw. Like, raw now, it will not have this, all this white something. Number 2, symptom of compulsion is shaking. This example, this person is always shaking. You will go and shake. Hey, see, you might have someone that you might be carrying someone that is having OCD in the car, and you will not remember, hey, are you even sure that I locked the door? Even if you have driven for 30 minutes, you have to turn back so that they go and check that door. Because if you not come back, that person will have panic attack. He will be restless. He will find himself in distress. You will see the person waking up at night like 3 or 4 times to go and check if he or she turned off the cooking gas. That is one of the symptoms of compulsive behavior. Another one is counting. You might see the person will just be like this and start counting. 1, 2, 3. No, they will be counting in certain ways. Another symptom is orderliness. Yes, they will keep on arranging things. You will see the person, you will see clothes that are arranged, clothes that are arranged already. Because she has gone there or somebody has gone there to remove one cloth and one piece side is outside, she will just, because of that small cloth that came out, and dismantle all the other clothes and begin to do what? To arrange them. And then you will see them, maybe she has decided that all her shoes will be facing this way inside the shoe rack. You will see all the time she will be doing what? Facing the shoe. She will go and be facing the shoe. Sometimes it will even make them not to sleep. She will just wake up at midnight and go and start arranging things. You see these people that follow strict, as in they follow some kind of strict routine. That is very strict routine. It is also a sign of a compulsive disorder. Now, the last sign is demanding reassurance, praying and doing some rituals just so that they will know that they are okay. So when you see someone that is always seeking for this reassurance, seeking for prayer, doesn't all the time, the person will just be like small times, hey God, please help me to do this one. No, as in they are silently praying all the time, as in they are silently saying some words to lift their spirit. Omo, check that person. That person might be having this OCDs. Is how severe can this OCD be? OCD severity varies. Yes, it varies because this OCD can start from childhood. Can start from childhood to teen, to adolescent, then to adult. And its severity varies. And you know, this OCD can change with time. The kind of OCD one have can change with time in life. Because it depends on the kind of life. Someone that is already having OCD from childhood, it can aggravate when the person is having more stressful life. Then the symptom can just aggravate. Some people that their own started maybe from teens, some their own started from adolescent or from adult, might have a lesser experience of these symptoms or moderate symptoms. Yes. And then people that their life are less stressful can also have a moderate. So that being said, someone with symptoms of OCD, it can be aggravated if the person is living a more stressful life. You can see. And you know, OCD is a lifetime kind of mental disorder. It doesn't go away. You can only manage it. Yes, it doesn't go away. Now, what are the causes of these OCDs? Number one on the causes of these OCDs is biological factors. Yes, OCD may be as a result of one's own body chemical changes or brain function. Number two, genetic factor. You and I know that almost the whole diseases or the whole sickness in this world is traced to gene. So if you have had a family history of someone with OCDs, it could be a cause for you. Then number three is learning. Someone can actually learn these OCDs and it will now become a habit, or like, yes, someone, for example, children that used to stay with a fellow child that stammers, before you know it, the one that doesn't stammer will begin to It's also the same thing with OCD. Once someone, and this thing affects people that don't usually, that their mental health is not all that strong. Yes, so when the person around them is having all these unwanted fears and all those things, they begin to learn it and begin to also have this unwanted fear. These are the three cardinal causes of these OCDs, though not scientifically proven, but theoretically proven. What are the risk factors of OCD? Yes, the risk factors that may trigger or aggravate these OCD symptoms is one, family factor. A family that have history of OCD is a very big factor. Then number two, stressful life events. A child that has been exposed to a traumatic event, or someone that has been exposed to too much of shock in life, can actually develop this OCD. It is a very serious risk factor. You see why you should avoid too much stress and pressure in your life, because these things can actually affect your mental health. Then number three is other mental health illnesses. Example, depression, anxiety disorder, mention but a few. So to avoid this, the risk of these OCDs, please, if your family have had a history of these OCDs, please check yourself early enough to see if you have it then, and take necessary actions. Number two, reduce stress. No, they always stress your life, I beg. Then number three, if you are down with other kind of mental health illness, please make sure to see a healthcare professionals to help you reduce the risk of these OCDs. So what are the complications that are associated with these OCDs? Yes, the complication. One of them is excessive time spent in ritualistic behavior. Like they spend too much time doing some kind of rituals to be able to suppress this distress and anxiety disorder, which is not even a solution to solving this obsession matter. Then number two, they can attract some health issues like dermatitis. I don't know if I pronounce it well. Dermatitis is a kind of disease that you can get by excessive washing of your hands. Yes, they might get that disease. Yes, another one is difficulty in attending schools, going to work, enjoying their social life. Yes, they don't do that because they are always scared. They are scared of touching someone that if they touch, they might get contaminated. They are scared of harming someone. They are scared of acting inappropriate. So that will now make them withdraw from their normal activities. Then this can cause overall low quality of life. It can cause overall low quality of life. Then this set of people usually have serious trouble in relationship, because when the person that they are with do not understand them, when the person does not even know that what they are facing is a sickness, they tend to have problem. You can imagine when you are going out with your wife, all of a sudden says, baby, please, I can't remember if I locked the door, please take me back. And you've already driven like 1 hour. And then, you know, some people that are not patient enough or maybe do not know that their partner is having that kind of issue, might begin to shout at the person, and the person will start having distress and anxiety disorder, which is very, very not good. So most of the time it affects their relationship. Yes. And the last one is suicidal thoughts. It is normal with every kind of mental illnesses. Anyone that is down with mental illness most of the time find themselves being suicidal. So in that case, if you are living with someone who is exhibiting these symptoms, these signs, please be patient with the person, be considerate, try to tolerate the person and help the person get through life. Now, can these OCDs be prevented? The answer is there is no sure way to prevent obsessive compulsive disorder. But getting treatment early enough can help reduce worsening of symptoms and reduce disruption of activities and someone's daily life. Yes. Now, what are the treatments to these OCDs? OCD treatment may not result to the cure of OCD. Like I said before, it is incurable. It is a lifetime something. But getting treatment will help keep the symptoms at bay so that it doesn't disturb your normal daily life activities. Like there are some people that you go to their hospital when you are sick. They are having this OCD. They are having some of these mental health illnesses. But you will not know. They are medical doctors. They are nurses. Because they have come to realize it. They go for treatment. They take their medications. And then it doesn't interfere with their daily life. Now, with this treatment, depending on the severity of the OCD, the treatment may vary. It might be long, ongoing, or even intensive treatment. And there are only two types of treatment. It is either treated by medication or therapy. But in some cases, when these symptoms are too much, when this OCD is at the high side, it might require both medication and therapy. That is all about the treatment. OCD cannot be cured. Are there home remedies for this OCD? Yes, there are some kind of lifestyle someone need to practice. Someone with OCDs need to practice, which are number one, practice what you learn. Yes, work with your mental health professionals and do what he or she directs you to do. That is one of the home remedy. Number two, take your medication as directed by your mental health professional. This OCD is not headache that when you take paracetamol, you feel like, this headache has stopped. You will stop taking paracetamol. No, OCD is a lifetime something. Therefore, you need to take your medication as directed because you will live to manage it so that it will not be interfering in other parts of your life. So don't abuse your drug. Take it as what? As directed. Just pay attention to warning signs. That is number three. You have been working with a professional and the two of you have come to conclusion. You have seen things that triggers these OCDs. Always pay attention to their warning sign to know when these things are coming so that you will be able to fight them. That is why you should always pay attention to the warning signs. Yes. Then number three, check first before you take other medication. Once you are having this OCD, you already know that you'll be taking medication all your life. Yes. Even common vitamins, common multivitamins, you are not supposed to. Do not go and take, once you are done with OCD and you are on medication, you are not allowed to go and take over-the-counter medications. No, you have to always consult your doctors to make sure that what you are going to take will not contradict the OCD medications that you are already in. If you begin to practice all these things, I believe you put this sickness at bay. You keep it at bay. You will not have problem. You will go about your normal life. How can one cope with this OCD? 1. Learn about OCD. Learning about this condition can help improve you and motivate you to stick to your treatment. Yes, once you already know about this OCD, what to do and what not to do, it will improve you and help you stick to the treatment and you will be fine. Number 2 is stay focused on your goal. Because you are having this, never mind. Stay focused to your goal. Stay focused to your recovery. Don't no go they think I'm say people go they think say I know well low. And a lot of fear that our people used to have when they have all this kind of thing. They are afraid. They are shy to go to the right authority to go and seek help because they feel if someone see them walking into the psychiatric hospitals, they will start calling them mad. Like, no. Stay focused at your recovery. It is your life. It is not other person's life. Now, number 3 is go and look for supportive group. Reach out to people that are having this same kind of health challenge and see how they have been trying to improve themselves. Then, by that so doing, you will become more interested in improving your own life. Yes. Find a healthy outlet. Yes, find a healthy outlet to always explore healthy ways. Yes, explore healthy ways to overcome this sickness. Then learn relaxation and stress management. Learn how to relax and manage stress. You don't need to overstress yourself. Do the things that naturally your body can carry. Then you are fine so that you can keep all these symptoms at bay. So the last one is stick to your daily activities. Try not to avoid your daily activities. Go to work, go to school, attend weddings, go to social events, social gatherings. Yes, you don't need to avoid all those things. You need to still live your life. That is why you have to take all these steps, take your medication, learn to work with your health professionals and the rest of them, and you will live your normal life. So please, if you don't know about OCD, I believe that my video has explained in details about OCD, what to do and what not to do, when to go to places and when not to go to places, so that if you are down with this or if you have someone around you who have symptom of this, please help the person. Don't be scared. Don't be shy that people will see you walking into the psychiatric hospital and begin to call you mad. No, it is your life. You want to get your life. What people think is irrelevant. So once you notice that you are having this kind of symptoms, please seek medical help and live your normal life like every other person. Thank you guys for watching this video. I hope this video motivates someone outside there. Please share this video because someone in your timeline might need it. Thank you guys and see you on my next one. Bye.